Sorry, we had some technical difficulties, so I'm going to go back a little bit just to make sure that this is actually on the video. So the effectiveness, so this is again about the Tuscany hospitals and effectiveness of homeopathic medicine, 13-year study. So it says a total of 20% of the patients reported that the complaint had been resolved. 27% had experienced a significant improvement. 22% reported a good improvement, and 21% a slight improvement. Only 0.5% of patients experienced a slight worsening. And so understand homeopathic medicine. You have to understand homeopathic medicine and its effectiveness, and also that you don't get the side effects from homeopathic medicine like some pharmaceutical medicine side effects of. So again, if we relate this, because they actually have a whole department that works with cancer patients, complementary medicine, and on a correct diet for cancer, to alleviate the effects of homeopathic medicine actually helped to decrease the adverse reaction of chemotherapy, radiation, and anti-cancer drugs in cancer patients to improve their quality of life. So, in all, patients treated with homeopathic reduced their overall costs of pharmaceutical medicine by 63.57% in their first year. If we're struggling in our healthcare system because of finances, wouldn't it be at least a solution to, or a practical approach to look at homeopathic medicine as a cost-effective way to work with patients? So this was the actual study, so you can look this up if you want, so I have all the information. So as well, homeopathic medicine has already been printed in oncology journals. So this is one I pulled off from PubMed, and it is about Ruta 6CH, about the effectiveness of using Ruta homeopathic medicine on brain tumors. And so listen to this. Of those 15 patients, 6 of the 7 patients showed complete regression of tumors. Complete regression. They used Ruta 6CH and they used calc phos, which is a tissue salt. Complete. Okay, understand that. No side effects from harmful chemotherapy and radiation, and as well cost effective. As well, there's been studies showing breast cancer and 4 homeopathic medicines that have been around for hundreds of years, since the 1800s. They were used in the 1800s, showing that they not only worked as effective as some chemotherapy drugs, but they had no side effects. And again, this way, it's also more cost effective. So we need to broaden our mind. You know, you can't just put your head in the sand and say, I've never heard of homeopathic medicine. Oh, I heard it didn't work. Well, you know what? There's studies saying it does work. Millions of people use it. We have to open our mindset here in Ontario. So, again, this is part of the study. They're doing it at MD in Texas at the MD Anderson Cancer Clinic on it. There's also studies showing from the medical side saying that they did an abstract on the effectiveness of chemotherapy and the cost effectiveness over a 5-year period of time. And from there, it clearly states that chemotherapy over a 5-year period of time, gaining life for people was only at 2.3%. 2.3%. There has to be other ways that we can work this. Cancer is growing. See, cancer will be rising 40% by 2030. We can't keep doing the same thing over and over again and expecting a different result. We need to make some changes, and we need to make them now. And as well, cancer, chemotherapy, secondary cancers are on the rise. Yes, it says because of longevity, but one of the points is because of chemotherapy. One of the side effects is it can give you another cancer. It is time for you and I, as as people in Ontario who pay our taxes, to be proactive. It's time for you to pass this video on to other people. It's time for you to go and write letters and talk to your members of parliament in both federal and provincial, because the money actually comes from the federal department to give to the provincial department for the Ministry of Health, but you should be the one that has a say in how it's being spent, because you're the one that put the money in there. Please, 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 you can make a difference. All together, we can all make a difference. I did my part. I explained this information to you. Again, they weren't my opinion. They were factual. You listen to this. You listen to this. Please, please, please take a next step and be proactive.